we're looking at about 45% of the country still not vaccinated with the first shot. There are states that have had very, very, very low vaccination rates. There is a Delta variant that's also spreading, concerning experts on a resurgence. So now what do we do? And also, how does that affect other states that have already achieved 70% at least one dose of the vaccine?
So vaccination has to be throughout the country. Right now, we are at that stage, slowed considerably from, we had 3.3 million at peak in mid-April, now less than a million, close to 800,000 people in June, every week vaccination. So vaccinations rates are highly uneven in the US, in the states, lower in many states in Midwest and Western states, and demographic groups also among young people. All those are biggest concern in the US. So I think we need to ensure that the vaccinations are equally distributed, equally received by the people in the US, and it definitely can impact because the travel restrictions are no longer in the US. So people from Western states can come to the Eastern states, and Eastern states go to the Southern states, and definitely that can spread into a newer pandemic in this country.
Doctor, why do you think young adults, people from the age of 18 to 27 are not getting the vaccine? I remember having a conversation with you a few months ago in which that age group was responsible for the surge we saw after spring break. So why are they not getting vaccinated?
Misinformation, lack of communication, consistent communication needs to come from all the way from the federal level to the state level to the county level, from the provider, from the pharmacy level. I think that is not happening. It has to happen, and if we don't get those individuals, I think we will definitely see a big surge in September, October coming.
Right. We're also getting the news that the country may fall short of President Biden's goal of vaccinating 70% of U.S. adults with at least one dose of the COVID-19 vaccine. What are your comments on it? And did we do a good job? Has the country done a good job in vaccinating?
So the good news is many states reached that 70% goal of at least one fully vaccinated individual. Only 16 states met that 70% goal. So it is a concern, and I think that concern needs to be addressed as quickly as possible, because right now we are in the golden period of taking the mitigating steps to increase the vaccination rates in the US between now and end of August, when the summer is over. I think by the time fall comes, September, October, and if we are not reached at that 65-70% rate, we definitely will have a huge problem in this country, and that is my prediction.
If the millions of people that are anti-vaxxers or choosing not to get the vaccine do not get the vaccine, can they affect vaccinated people eventually?
That is the concern right now, and I think that was one of the best questions so far, that we need to ensure that we need to protect those individuals who are not vaccinated. So if we cannot protect those young individuals, and a lot of people, young individuals, are in the hospital right now, and we need to ensure that those individuals are vaccinated, because they can get the infection from other people.
Right, and let me just also get your word on the fact that even if you have had COVID, you should still get the vaccine, because there's misinformation where they're saying that it's not needed because they have antibodies. Your comments?
Absolutely, the vaccination is required for anyone and everyone in this country, irrespective of their previous infection. After 30 days, they are eligible to take the vaccine, unless they have some clinical conditions which their doctor recommends not to take the vaccination. Otherwise, most of the individuals are eligible to get the vaccine, and they should get the vaccination as quickly as possible so we can leave this pandemic behind us.
Right. Let's now talk about vaccines in children, doctor. I have a couple of questions here. Let's talk about the age group of 12 to 17, which now has the Pfizer vaccine that they can get vaccinated with. How are you looking at that age group? How is the progress of vaccination in there?
So that is the biggest concern. The age from 12 to 24, less than 50% of those population is received their first vaccine. They need to get their full vaccination, 2-dose vaccination or Johnson & Johnson vaccination right now. And the rates of vaccination going in this country right now are very, very poor. We need to improve that, and if we don't improve that, it's going to be a problem when the school starts in September.
There's a lot of hesitancy getting children of that age group vaccinated. Parents are questioning, are there going to be developmental issues? Is it going to affect, anything else in their immune system? What do you have to say to those parents?
My strong recommendation to the parents right now, the risk is not that great. The side effects from the vaccination is minimal. The vaccination effects, the benefits are much more higher than the vaccination side effects. There are no long-term complications from this vaccination as per the clinical trials. I would highly recommend all the parents for their children 12 and above get their vaccination as quickly as possible, because if they are not, they may get sick, they may get infection, they may get severe disease from this Delta variant, and we may continue with this pandemic for a longer time.
So important to get that vaccine. We love to promote that idea. Let's talk about children ages 2 to 11. Pfizer and Moderna are both doing clinical trials on them right now. We are hearing that there's a lower dose of the vaccine given to this age group. There are also trials happening on 6 months to 2 years old. We're hoping to get some results on the 2 to 11 by September, and from 6 months to 2 by October or November. How are you looking at all of these age groups? What is happening in these clinical trials? How safe would this vaccine be for people that are actually in their developmental ages during these age groups?
So for 2 to 12 years age group, we are in the third last clinical trial stage. And hopefully, like you mentioned, by September, we should have some kind of data available for the FDA approval for the emergency use authorization. The under 2 years of age are still lagging behind. We are only on the clinical stage 2 for the trials. So I would say for the younger than 2 years of age is going to be next year. But I'm very much hopeful that for the 2 to 12 years age group, we should have the vaccination by fall, early winter for sure.
Right, so this brings me to my million-dollar question that I love asking doctors. Schools in the fall, how should they function? Especially in the age groups that are not going to be vaccinated, kindergarten, elementary school, middle school perhaps because you have 12 and above getting vaccinated. Should they wear masks, social distancing? How are you looking at all of this? And what about the teachers there? What should they be doing?
So if they don't have the vaccination for children under 12, I would definitely recommend, and I think the recommendation from CDC will also come when the school starts in September, that the mask will be required for them. The social distancing guideline probably has to be changed, and I think from 6 feet to it will come to 3 feet already came last year. I think for the teachers and the school staff, it will be on a case-by-case basis. If they are fully vaccinated, they can take the chance. I would highly recommend at this point that the school children, before they go to school, at least they have 70% of school children are vaccinated, whoever are eligible to get the vaccine.
Do you think schools should require vaccination for everybody that is eligible?
I have been telling that for the employers, for the airlines, for the big companies, for the sporting events, for anything, they should have required to have some kind of vaccination proof, because that will be the biggest incentive for people to get the vaccine. If we don't allow that, I think those 20-30% people will still not get the vaccine and will go back to the square one again.
And these children who are not going to be vaccinated, who are already right now, mingling in the parks, going to summer camps and all of that, do you think they could add into the surge that we are now predicting in the fall?
Absolutely, because as long as they stay outside and the close contacts are not there in the outdoor setting, but if they are indoor and if they are mingling with the people with vaccinated and unvaccinated, definitely that can lead to a newer surge in fall and winter months.
Doctor, what's your prediction for the next coming months, especially looking at children?
I'm hoping July and August 2 months we ramp up our vaccination rates from right now from 45% to 60%, that is 15%. It's difficult goal, but we can do it in this country. And if we cannot do that, I think I see a huge problem coming up in September, October months when the fall and winter hits.
Oh, I hope everyone listens to you so we don't have to see what we saw last year. Two more questions left here for you, Doctor. We always talk about South Asians on this network. I'd like to know, how at high risk do you see South Asians right now? Because we've been at high risk this whole pandemic. We've been giving advice on that. What is your advice now?
So good news is South Asians, especially Indian, Pakistani, Bangladeshi, Sri Lankan, we work so hard for them to get the vaccination. And I think our rates are much more higher than the other minority groups. And my predictions is, as long as they have the vaccination, both vaccinations, they can do many of their routine stuff in the summer months without any restrictions. If they go indoor, setting where they have a large crowd, they need to protect themselves if they have immunocompromised state, or if they have diabetes, if they have cardiac conditions, they need to be careful with their daily activities.
Right, and that brings me to my last question, Doctor. When you are looking at people with diabetes, heart conditions, lung diseases, again, very cholesterol issues, all of that is in our South Asian community a lot, how are you looking at masks for them? Should they be wearing masks even now, even if they're vaccinated? How should they sort of, make that judgment?
So for indoor, for those people with the chronic medical conditions we mentioned before, they should wear the mask if they are at risk, if they are obese, if they have a history of smoking, if they have a history of immunocompromise, some cancer, some other immunocompromised disease. They should protect themselves, even though there are no recommendations for them to wear the mask. For outdoor activities, I do not recommend for them to wear mask at this point if they are fully vaccinated. But for indoor with the large gatherings, and if they are with the people whom they don't know, I think they should wear the mask.
Yeah, this mask has always been a big question. Let's hope everything gets better the next time we have you on air. Thank you so much for giving us your time today.
Absolutely, and I'm hoping people understand the virus is still here. Take it seriously and get the vaccination as quickly as possible. To all my young individuals in this country, don't fight this. Get the vaccine. That is my message.